Hi, this is Dr. Swetha Kumar, UVA Medical Retina and Cataract Consultant at Dr. Agarwals Eye Hospital, Nagar in Chennai. I'm going to talk to you today about after-cataract. So, cataract, as you all know, is the lens inside the eye becoming opaque. So, this lens is held in place inside a bag called the capsule. So when we're doing the surgery, we just make a tiny opening in the front part of the bag called the anterior capsule, and we remove the cataract, and through the same opening we put the artificial lens back in the eye. So the artificial lens that's placed back in the eye rests on the back of this bag called the posterior capsule. This capsule, much like a part of the cataract, tends to opacify a little over time. When you develop these symptoms, please come back. So we'll do a dilated eye examination, make sure there's no other problem in the rest of the parts of your eye. And once we identify that this is the only thing, the posterior capsule opacification or the after cataract is the one that's causing your visual symptoms, what we do is we clear it with a small laser. This laser is an outpatient procedure. So this is done in the OPD itself with a machine very similar to the slit lamp which we use to examine you, and the process is probably even faster than your eye examination. It takes just a couple of minutes. So a couple of shots are fired and a small opening is made in the posterior capsule, and then once that opacity is cleared, your vision becomes clear again. So this, you get almost instantaneous relief. So if you have any further questions or are experiencing similar symptoms, please feel free to reach out to Dr. Agarwal's Eye Hospital.